AIDS has indisputably grown into a full-blown epidemic, with 33 million people living with HIV/AIDS and more than 25 million who have died of the virus. The rapid spread of the disease is a global issue, but it has disproportionately affected the poor and developing countries. 2/3 of the world's infected population live in sub-Saharan Africa. To prolong the lives of those living with AIDS, antiretroviral drugs are essential. These drugs reduce the viral activity of the taker, strengthening the immune system and thereby prolonging and improving the quality of his or her life. Wealthier and more developed countries, such as the United States, can afford the high cost of these drugs. However, the high prices often exclude more widespread use by poorer developing countries. The cost of brand-name antiretroviral medications can be over $1,000 annually, putting them well out of the reach of families often earning the equivalent of $200 or less a month. The high cost of drugs is not completely unjustified. It is due largely to monopolies created by patent laws. Patent laws are designed to motivate innovation, since the research and development of new medications to treat AIDS can cost hundreds of millions of dollars and years of time without any guarantees of producing an effective drug. By obtaining patent rights, pharmaceutical companies can assume monopoly power and set extremely high market prices. This market power enables them not only to regain the considerable costs of research and development, but also provides them with a large profit and therefore a justification of the risks associated with the development of new medications. In order to obtain lower prices which are more accessible to the general public, it is essential to foster competition by encouraging the production of generic versions of the drugs. But unless generic producers are granted legal access to the information detailing the production of the original medications, they are unable to produce them. However, granting the exclusive rights of production and distribution to a single pharmaceutical company is not the only way of using patents to encourage innovation. If patent-holding pharmaceutical companies agree to enter into an organization known as a patent pool, then the production of cheaper generic versions of the medications may be facilitated within developing countries. A patent pool is characterized by multiple patent holders agreeing to license their patents to a single governing entity. Once the licenses are consolidated within this entity, countries or generic producers may access them by paying a royalty, which then generates income for the companies who contribute to the pool. If structured carefully, patent pools can help foster innovation in several ways. First, consolidating the rights to several different drugs encourages the development of fixed-dose combination medications, such as Combivir and Kaletra. Fixed-dose medications reduce pill burden so that people have to take fewer drugs at one time rather than up to 10 pills per day at different times under different circumstances. They also hinder the development of resistant strains of the virus by ensuring adherence to all medications. Resistance has been a particular problem with HIV, since the virus tends to mutate so quickly. As soon as a drug stops working for one person, if they pass on that strain, the drugs may stop working for others as well. Patent pools make the development of these types of drugs quicker and more painless for developers because they need only deal with the single pool to gain access to all required medications, rather than navigate the complicated legal bureaucracy associated with different patent holders multiple times. Licenses in the pool will most likely apply to a wide geographical area, which means that potential producers may have access to sufficiently large and attractive markets. Finally, patent pools may also encourage innovation by funneling a percentage of the profits from generic producers directly into further research and development. UNITAID, an international organization created to facilitate the purchase of drugs against HIV/AIDS, tuberculosis, and malaria, recently began taking steps to establish a patent pool. UNITAID has defined its mission as scaling up access to treatments for these diseases by negotiating lower prices for necessary medications and making them available faster. Established in 2006 by Brazil, Chile, France, Norway, and the United Kingdom, it is uniquely funded from taxes on airline tickets, where all member countries impose a small tax on passengers departing on flights from their countries.
Chaque année, des millions de personnes meurent par manque de soins. Sur chaque billet d'avion, une somme d'argent prélevée sera directement convertie en médicaments grâce à UNITAID.
By guaranteeing this funding, UNITAID can continuously analyze market dynamics to identify particular problems and address them by leveraging purchasing power to influence manufacturers. Former President Clinton praised the work of UNITAID in helping to facilitate lower drug prices at the Global AIDS Conference in Mexico in 2008.
With the manufacturers, we took the price to $190 a person a year. When UNITAID's funding became available, we negotiated a price of $60 a year. In other words, we can now keep 10 children alive for the same price that just 3 or 4 years ago, we could only keep one child alive.
We've lowered the price of medicines, especially for children, by more than 60%, thanks to UNITAID, thanks to innovative financing, and thanks to France. I can only call on those countries who are not there already to come and join us.
In establishing a patent pool with the help of Doctors Without Borders, UNITAID hopes to continue to provide people in low and middle income countries with increased access to better quality and lower priced medications. Most importantly, the patent pool structure will make it possible to scale up access to fixed-dose combination medications. The success of the patent pool structure will be dependent on whether or not patent holders are willing to exchange the relevant patent rights in the pool for royalties. But if UNITAID can successfully put the patent pool into place, generic companies will be able to obtain the licenses necessary to produce fixed-dose combinations much faster. The impact for both access to medications and for medical innovation on developing African economies could be enormous.
Kwani nini zambi kwa Mwenyezi Mungu? Kipya ram kipya lali. Hii ni siasa, dini, vita, bwana utawala. Simama imara, zunguka kila kona, kila anga ngaza. Kushoto kulia, mbele nyuma, kote pitia. Hapo ulipo jishikiza na wala. Hii ni mahususi na maalum kwa watu wangu.